Thank you, Prof. Tan, for attending this summit. My first question to you is, what's the key takeaway that you want the audience to impart from this Pharmacogenomics Summit, especially among the non-healthcare professionals?
So as a pathologist, I think one of the important thing that we often practice is precision medicine. It's actually an activity that we are doing. Like for example, I give a case of breast cancer. In breast cancer now we test for ER/PR and HER2, and those who are positive for, let's say, HER2 are subjected for treatment with Herceptin. So it is a form of precision medicine. Therefore, it is an important thing that everybody should know, and even the public should know now that this type of treatment is available. Pharmacogenomics is one of the precision medicines that we should be also looking into at this point.
What advice would you give to the young researchers who aspire to implement this pharmacogenomics, and also all clinicians as well?
Because I'm a perinatal pathologist, I would say on behalf on placenta, which is my area of expertise. At the moment, I am looking into fetal growth restrictions, and we look at how nutrient transport around the syncytial trophoblasts in the coronary villi. And I happen to come across some articles looking at genetic variants, just like pharmacogenomics, that can happen in the transporter genes in this syncytial trophoblast. Therefore, I think that could be the next stage where we can go into research, which I don't think anybody else in the world has done it yet. At the moment, what we are trying to do is we're trying to see the expression profile of GLUT1, amino acid transporter, and FAT transporter, which is the fatty acid transporter. We're trying to look at that, how the expressions profile relate to the fetal growth restrictions. And also we are now doing electron microscopy, looking at the villi of the syncytial trophoblast, whether the thickness, the length and everything correlates with the absorptions of the nutrients or not. So I think the next step could be the gene variabilities that happens in these particular regions that we can look into. That is in regards to my area of expertise.
What is the thing you want people to take as a summary?
So going through the whole entire day, I think in order for implementations of pharmacogenomics in Malaysia, I think one of the important things is awareness. Awareness at particularly 3 levels. So the first level is probably at the university level, where pharmacogenomics should be taught to the students in a much more detailed manner, and therefore we have a basic understanding of pharmacogenomics even though we haven't even come out. So pharmacists, a medical degree, all needs to have all pharmacogenomics background. So it has to be taught in the university itself. Second level is public. So the public also needs to be aware that pharmacogenomics is actually very important and useful, and that can prevent side effects and toxicities and so on. So public is the second stage that awareness needs to be given to. And lastly, the clinicians, the doctors, also needs to be informed of such pharmacogenomics availabilities in our country already. So I think awareness is a must.
Prof. Tan, thank you so much for